As a palliative care doctor, I am frequently asked about treatment strategies for nausea that do not involve taking more medications. What are those strategies? How do they work? Will they work? In this video, I will discuss the main non-pharmacological treatment strategies that can be used to relieve nausea. Let's talk about it. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. In part 1 of this series, we broke down the many different causes of nausea and the effect they can have on the vomiting center in our brainstem. If you haven't seen that video, I will leave a link in the description box below. Non-pharmacological treatments can be effective for mild to moderate nausea, but we have to keep in mind that people may respond variably to these. Furthermore, the cost of these strategies can range from being inexpensive to inaccessible. So let's dive in. Firstly, it is very easy for people to tell you to avoid the triggers that are known to aggravate your nausea. And this can range from avoiding certain body positions, certain foods, or certain situations. And this is a very important first step. But in the context of palliative care, and in the setting of advanced organ illness, this is much easier said than done. I would still encourage you to minimize the triggers as best as you can, and where you can. But I empathize that there are likely multiple factors that are completely out of your control. Let's now talk about things that we can do that are generally accessible. Let's start with fresh air. Now, personally, I get seasick pretty easily, so I try very hard to avoid being on a boat as much as I can. But sometimes, I just don't have a choice. So, think of the last time you experienced motion sickness. What did you intuitively do? If we are on a boat, we try to go out on deck for fresh air. Or, if we're in a car, we open the window in order to feel the wind on our faces, right? Well, what does fresh air do, and how does being outside make a difference? Going outside or to a more open space can have a calming psychological effect. But there's more to it than just that. Stimulation of certain nerve endings in the face by flowing air can make the brain perceive or think that it is getting more air. And this effect may indirectly calm the sensation of nausea. The temperature cooling effect of moving air may also play a role. In some people, nausea is accompanied with associated symptoms such as feeling warm, flushed, or sweaty. And this is due to the fight or flight response and the activation of the sympathetic nervous system. The presence of cooler air or cooler ambient temperatures can help counteract some of these symptoms. Being outside or in a larger space can also allow our eyes to focus on objects that are further away, such as focusing on the horizon if you're on a boat. And this can have a stabilizing effect on your vestibular system, which may help lessen the sensation of nausea. Well, what if I can't get outside? In that case, try to open a window to get fresh air into the room, even if it's wintertime. This will also help to decrease the ambient temperature in the room. You can also set up an electric fan nearby that can circulate air around the room, or you could direct the airflow across your face. Smaller handheld battery fans may also work as well. For some, cold compresses or a cool damp cloth to the forehead or back of the neck can also be helpful. It may not seem like much, but for many people, these accessible strategies can be very effective for alleviating mild to moderate nausea. Let's now talk about things we can do to minimize and prevent nausea in terms of what and how we eat. In patients experiencing nausea, appetites are often pretty low, but maintaining adequate hydration, where possible, is still important. So, firstly, make the portions of food and drink more approachable. What do you mean by more approachable? When we are nauseated, being presented with a large amount of food or drink can psychologically make the sensation of nausea worse. And I see this all the time. Well-meaning family members and friends often leave several bottles of drinks and a full plate of food in front of them as a sign of love and support. Through the eyes of the patient, however, the sight of this is often not welcomed. They appreciate the gesture, don't get me wrong, but most are too polite to say anything. As such, I suggest having smaller quantities of liquid and food in front of the person who is nauseated. It visually looks less daunting. Small bites of bland, dry, starchy foods, such as plain crackers, and smaller sips of fluid taken more frequently is often much better tolerated. Cooler temperature foods and drinks may also be better tolerated, and many of my patients enjoy homemade popsicles from frozen fruit or diluted juices, provided they like the flavor. What about ginger ale? Now this is an interesting story. The effectiveness of the soft drink ginger ale for treating nausea is mostly a myth because these drinks typically have very little actual ginger in them, even though it says made from real ginger. Actual fresh ginger has been used as a traditional anti-nauseant for centuries. Now, in part 1, we learned that delayed gastric emptying and gastric stasis can cause nausea. Well, the active ingredients in ginger, the gingerols and the shogols, likely have a role in blocking the effects of the neurotransmitter serotonin, both in the gut and in the vomiting center. And in doing so, ginger may improve gastric emptying and motility. Gingerols may also have an effect on reducing the activity of the neurotransmitter substance P and its related NK1 receptor. Now for some, ginger can have a role in treating motion sickness, and it may also have a role in treating nausea induced by chemotherapy. But ginger ale, the soft drink, is less likely to improve nausea from the ginger content alone. If it's ginger you're after, you may want to consider fresh ginger or ginger in the form of supplements. All that being said, ginger ale may still be comforting to some, but more likely from the carbonated bubbles, the taste, or a psychological comfort factor. And on the topic of carbonated bubbles, this may be comforting to some, as it can allow for gas release from the GI tract through burping. But in others, the bubbles may actually worsen nausea due to the discomfort of burping itself. And for some, this can even stimulate a gag reflex. So if this describes you, you may want to let the drinks flatten out before you drink them. Are there certain foods to avoid? I would suggest avoiding very rich and high fat content foods, as these can result in slower gastric emptying, as well as increased gallbladder and pancreas activity, which in some people can further worsen nausea. Fat also takes longer for the stomach and intestines to break down, which can cause further sensations of indigestion and bloating. I would also suggest avoiding spicy foods. Capsaicin, the compound found in chilies, can result in more GI tract inflammation, can increase acid reflux type symptoms, and similar to other factors that we already talked about, can further delay gastric emptying. The temperature of food may also play a role, but not necessarily for reasons you might think. You see, hot temperature foods tend to emit more aromas and odors, which may further worsen the sensation of nausea in some people. As such, I would suggest preparing and eating room temperature or cooler foods. For example, you can prepare cold plates, such as small sandwiches or chilled pasta, which generally have less aroma compared to steaming hot soup. I would also encourage you to try to keep the room air as free of odors as possible, even if these aromas were previously enjoyed. Although inconvenient and highly impractical, it may be helpful to cook food elsewhere or when the patient is not nearby. Let me give you a personal anecdote. I frequently hear from my patient's spouse or family members that they attempted to cook and prepare the patient's favorite meal, only for the patient to tell me privately afterwards that the smells coming from the kitchen made them want to vomit. This is so frustrating, right? But it is no one's fault. In this case, the family members mean well, but the physiology of the body is such that when we are ill or when we are nauseated, foods and aromas previously enjoyed may now be less well tolerated. Is there anything we can do after eating to help alleviate or prevent nausea? Yes. For many, sitting more upright after eating may help with quicker emptying of the stomach, which will help prevent food from regurgitating back up the esophagus. Sitting more upright may also help minimize acid reflux. In contrast, lying flat after eating can make all of these factors worse. Here's a very important suggestion. After eating, keep the mouth clean by rinsing and brushing teeth to remove bad tastes. In between meals, keep the mouth as moist as you can. Now, this may not seem like much, but cleansing the palate and maintaining really good oral hygiene can go a long way towards minimizing nausea. What about scents and aromatherapy? Peppermint, lemon, and lavender scents have been traditionally used to treat nausea. In some people, these may have a calming effect. Peppermint in particular may also have a role in blocking the activity of the neurotransmitter serotonin and its effect on the vomiting center. The menthol in peppermint may also have an antispasmodic and smooth muscle relaxation effect on the GI tract. However, the effectiveness of aromatherapy for reducing nausea is inconsistent and variable. There are patients who love the scents of oils and related products, but I also have patients where strong scents make things worse. In this setting, scent-related treatments need to be approached on an individual basis. What about other complementary therapies? Will those help? Short answer, maybe. It really depends on the person and their underlying illness. Nausea is such a subjective symptom, and everybody's response can be variable. With respect to complementary therapies, I've had patients who really benefited, while others experienced either mixed results or had no perceived benefit. Furthermore, some of these therapies are not covered by healthcare plans and may require out-of-pocket payments. So I would suggest proceeding with care. But let's talk about these. Acupuncture has been used to relieve nausea for centuries. The stimulation of the PC6 point likely results in the release of specific endorphins and hormones that can inhibit activation of the chemoreceptor trigger zone, and in turn, the vomiting center. And this may explain why acupuncture can be effective in people with chemotherapy-induced or post-operative induced nausea. Acupuncture may also have an effect on improving gastric motility, and as such, may explain why it has a role in alleviating nausea associated with motion sickness and pregnancy. Now, if you do not like the idea of small needles being inserted, acupressure for nausea also involves the stimulation of the PC6 point, but this can be self-administered and does not require needles. What about relaxation strategies? I've heard those might be helpful. Diaphragmatic breathing exercises, guided imagery, and meditation may all be helpful. These likely work through a stress reduction type mechanism, allowing your body and mind to better cope with the sensation of nausea. It has also been hypothesized that these techniques may decrease the release of serotonin, resulting in less activation of the vomiting center. In patients with chemotherapy-induced or post-operative nausea, music therapy can also be an effective strategy. There are several proposed mechanisms, including better neurohormonal regulation, improved pain sensation through stimulation of the brain's auditory center, and through the release of endorphins, which may improve one's emotional regulation. Progressive muscle relaxation, or PMR, is slightly more complicated as the technique involves the contraction and relaxation of specific muscles in a specific order. PMR may be beneficial in alleviating nausea induced by chemotherapy. Now, on to a more specialized relaxation strategy. Biofeedback techniques may help reduce nausea by reducing some of the associated symptoms, such as increased heart rate, sweating, and the uncomfortable awareness of breathing. These techniques may help with decreasing the fight or flight response of the brain and can help shift the person into a more calm and controlled state of being. The effectiveness of these complementary techniques can vary widely among patients. But the take-home message here is that heightened stress and anxiety will worsen the sensation of nausea. So any technique that aims to reduce the high stress state may contribute towards reducing the sensation of nausea. Are there things you can do to reduce anticipatory nausea? Being aware of the situation and making attempts to change how the brain reacts to nausea-inducing settings is the basis for how these work. Here, cognitive behavioral therapy and mindfulness techniques could be used in patients with anxiety-driven or anticipatory nausea. Hypnosis can also be helpful in this setting, although in a medical context, likely best delivered by a trained and qualified practitioner. The aim of these techniques is to change how a patient perceives a setting that is associated with nausea by deconditioning the brain's reaction to certain sights, sounds, and smells. Hopefully we can break the connection between certain stimuli and the response of nausea. Overall, these complementary therapies lack rigorous scientific testing and large clinical trials. So we don't have a body of evidence to either strongly support or deny their effectiveness. They may work really well for some and less well for others. Furthermore, techniques that require a practitioner may not be covered by health insurance plans, and that cost may make them less accessible to the general public. To summarize this video, we discussed several non-pharmacological treatment strategies to relieve mild to moderate nausea. We spoke about the importance of fresh air, having airflow across your face, and lowering the ambient temperature in the room. We then spoke about making fluids and food appear more approachable, and things to avoid when it comes to food. We discussed the role of ginger and how it may have several different effects on the nausea pathway. And lastly, we spoke of complementary therapies such as acupuncture, acupressure, and relaxation techniques, and the role they may play in helping alleviate nausea. Thank you very much for watching this video. I hope you found it helpful. Please stay tuned for part 3, where we will be discussing pharmacological treatments for more severe cases of nausea. Hope to see you then.